Hi, I'm Dr. Richard Amy, and today we're going to talk a little bit about the education portion so you get a better understanding of pain, headaches, and migraines. And really understanding the interrelationship of how pain works, how headaches work, and how migraines work. So when we look at different types of pain, we only have three ways that pain is mediated in the body or to where we feel it. And I'm going to go over those real briefly with you. The first way is mechanical pain, such as I put my finger into my forearm here. That causes mechanical pressure that tells a signal for the pain fibers up into brain. Now, once I take my finger off, take the mechanical pressure off, guess what? The pain goes away. So whenever we get muscle spasms, we get trigger points, we have injury, we create scar tissue, that's a type of mechanical pressure that's put onto the pain fibers that go through the spinal cord into the brainstem and up to brain. The second way that we get pain is through a chemical depolarization of pain, whether that's from acidity in the body, unless it's a neurotransmitter such as serotonin that's released in the bloodstream on migraine patients, whether the joint is breaking down, causing some chemical irritation from that buildup. That's the second way. And the third way we usually don't see in a clinical experience, but I need to explain it to you as well, is when we burn ourselves, we put ourselves on a hot stove, we get a withdrawal response. And the second way would be frostbite. So mechanical, chemical, and then thermal. Thermal not usually seen in the clinical experience. Now that pain travels up the spinal cord and 80% of the pain fibers stop off in an area called the brainstem. And then the other 20% actually go to brain, to our cognitive realization of brain. So let's go through it. There's 3 analgesic spots or pain inhibitory centers in the body. 1 in the dorsal horn of the spinal cord and 2 in the brainstem. So if I get pain here, in order for my brain to perceive it, it has to go through 3 spots that inhibit pain before we realize it. Now, what is the brainstem and what is brain? The brainstem would be more like the Intel processor. The brainstem controls heart rate, it controls breathing, it controls the digestion, it controls hormones, it controls the pain inhibitory centers, it controls the arousal or the wake centers to it. So the brainstem really controls all these things going on, and there's about 12 cranial nerves that are located in the brainstem. And we're going to talk about those a little bit more. Now, the brain is for cognitive ability. Our idea is to process thoughts and actually to problem solve, to hear, to see, to do multiple type of things. That's the cognitive ability that is happening in the brain. So let's recap. Pain can be mediated 3 ways: through pressure, mechanical, chemical, and through thermal. That process tries to be stopped before it gets to brain at 3 different centers: dorsal horn of the spinal cord, and 2 areas in the brainstem. Now, when we look at headaches and migraines, there's been a lot of different things that have happened over the last decade and a half, and especially over the last couple of years, to now we're starting to understand how headaches and how migraines work. My job is to educate you so that you understand that 100% of headaches, through research that was done back in 95 and 96 through Nikolai Bogduk, specifically proved that 100% of these headaches came from an area in the brainstem called the trigeminal cervical nucleus. Let's look at what that nucleus does, or what the input into that particular center is. The trigeminal nerve is cranial nerve 5. It's the one that controls the TMJ, temporomandibular joint. It's the one that controls the teeth and the muscles of chewing and the upper cervical spine. So the trigeminal cervical nucleus. So what Bogduk found out, that when this area of the brainstem gets overexcitatory, it has a relationship with the baroreceptors in the vascular system that cause a vascular response. So again, when this area gets overexcitatory, it sends a signal to the brain to cause the blood vessels to vasodilate. When I mean vasodilate, that means they go from maybe a smaller than normal to a normal situation, and they get very big. Around those blood vessels are pain fibers. So when this area sends a signal to causes vascular event. It's usually as a consequence of decreased oxygen to the area and this bombardment by a trigger. Now, what would a trigger be? A trigger is a non-constant, but it's usually an excitatory. That means it could be a muscle spasm, it could be a trigger point, it could be a pain wind-up loop, it could be a food or environmental allergy. It could be MSG, monosodium glutamate, which is an excitatory neurotoxin that it overexcites this area that causes this response. So my analogy is this area of the brain is sort of like a bucket. And what goes into the bucket? What's the primary points that go into the bucket? It's the input from the muscles, the teeth, the joint, and the upper cervical spines. What throws this out of balance? We find that the three major things that throw this out of balance are people that clench and grind. We find people that have had whiplash accidents, whether it be from motor vehicle accidents, sports injuries, horseback riding, gymnastics, soccer, any multitudes can also throw this out, and an imbalance in the teeth. So I need you to really understand that no matter what this trigger is, and I think in the medical community, we have over 212 different triggers. Like I say, they can be muscle spasms, they can be environmental toxins, they can be food additives, they can be a food allergy such as dairy. It could be red wine, it could be chocolate. Oh my gosh, not chocolate, right? How can chocolate be bad for you? But again, this area of the brainstem is out of balance, and the out of balance comes from the muscles, the joints, the ligaments, and how the teeth come together. And understanding the big things that throw that off can be clenching and grinding of your teeth, trauma to the area, and in certain cases, orthodontics. When you're born into a physiological position. Sometimes when we change that physiological position, there's a certain small percentage that cannot adapt to those changes, and we find that those patients get headaches 3, 6 months, a year, 2 years after the orthodontic work. The same thing happens with the motor vehicle accidents. Usually it doesn't occur right away, but it's over a period of time. So it's important for us to really understand what's going on. Now let's talk a little bit more about the headaches and migraines and understand sort of the differentiation between the two. A normal headache is usually a mechanical pain headache, okay? So I've overworked in the garden or was doing a sports activity, and now I have increased muscle spasms, and this muscle spasms is decreasing blood flow to the area, and my baroreceptors in my neck are saying, hey, I'm not getting enough oxygen to the brain. We know that the brain and the heart are the two most oxygen-sensitive organs in the body. And this is not a good thing. How long can we survive without oxygen to the brain? Only a couple minutes before we have permanent brain damage. When the body senses this, the body sort of pulls the fire alarm. That gets out the big hoses and tells the blood vessels that are constricted to vasodilate. And when they vasodilate, we get the mechanical pain because the pain fibers are wrapped around the blood vessels. Now, if I was to take a non-steroidal anti-inflammatory like Excedrin, or maybe if I'm not a coffee or a caffeine drinker and I had a Coke or some caffeine, many times that will get the blood vessels to relax. I release the pressure from here, the mechanical depolarization, and guess what? The headache goes away, maybe in 5 minutes, 30 minutes, an hour, 2 hours, when the body can relax. That's a typical headache. Now, if the body cannot get these blood vessels to relax, then it sends a neurotransmitter called serotonin. And serotonin is the neurotransmitter that makes you feel good. It's the one that all the antidepressants are based on. Prozac and Paxil try to keep as much serotonin in the brain because it's the feel-good neurotransmitter. It makes you excitatory. It doesn't make you depressed, correct? So now we release the serotonin, which is a chemical, from in the brain into the bloodstream. When we do that, the serotonin now causes a chemical depolarization of pain, and I have two types of pain, the mechanical and the chemical. Serotonin is also a massive vasoconstrictor, so the job is to actually vasoconstrict. Now, why does a migraine patient headache last for 6 hours to 2 or 3 or 4 days? It lasts for that period of time because it takes a while for the body to come back and reabsorb all the chemicals that it's been released. So until that is done, we will have pain, unfortunately. So we look at a normal headache, mechanical only. We look at a migraine, has both a mechanical and a chemical depolarization. And we look at the vascular event, which will cause us light sensitivity, sensitivity to smells, and a whole load of other sensory inputs that become aberrant. So it's important to know where the headaches start from. Where do they start from? 100% of all headaches start from the trigeminal cervical nucleus. The non-constants that overstimulate that, number one, probably being muscle spasms and trigger points, bite imbalance, damages to the joints through trauma, and then there's a whole load of other ones. Environmental allergies, food allergies, red wine, chocolates, a whole bunch of other things that they've named, 212 of those. So that non-constant comes in, goes to the brainstem that's overexcitatory, boom, that triggers it, the bucket overfills, and what spills is headaches and migraines. Where the problem lies from, it's always from an imbalance between the muscles of chewing, the cervical spine, the temporomandibular joints, and how the teeth come together. This is so very important. When we understand that the temporomandibular joint has more input to brain than any other joint in the body. What's second? Cervical number 1. What's third? Cervical number 2. What's fourth? Cervical number 3. That's the greatest bombardment into brain. We are a sensory-based organ. The more input we have, the better. But when we look at brain's job is for cognitive ability, to understand. But 70% of brain's job is to inhibit or to slow things down. To slow down my blood pressure, slow down my heart rate, slow down my breathing, slow down my acidity in my stomach so I don't have reflux, those type of things. It's to slow down pain and to inhibit these things such as headaches and migraines. So it's important for us to really understand where the source of the problem is, what are the triggers, and how do we do to balance it.